Добрий день, друзі. Я вітаю вас.
Good afternoon, dear friends. Welcome at Ukraine Media Center. We have been supported by the Ministry of Defense of Ukraine and the Ministry of Internal Affairs of Ukraine. And now in our studio we have the Minister of Public Health of Ukraine, Mr. Liashko. And today we will discuss the operation of the health facilities and generally the healthcare system in the wartime. Victor, you're welcome. You have the floor. Thank you. I wish everybody good health. The healthcare system as a whole, including the treatment and pharmaceutical components, has not stopped its operations since the beginning of the war and since the beginning of the full-scale invasion of the Russian Federation in Ukraine. During this time, the Russian military, who are just terrorists in the territory of Ukraine, violated all existing conventions, including Geneva Conventions, by attacking civilian facilities, including buildings with Red Cross, that is hospitals. 135 hospitals have been shelled. 9 hospitals have been completely destroyed, so that it's completely impossible to repair them. We just have to build new hospitals in those places. 43 ambulances have been shelled. 6 medics have been killed and 16 medics have been heavily wounded. Yesterday, there was something shameful on the global scale when the ambulance team was taking hostages when they were accompanying the humanitarian convoy. I think it never happened worldwide. Only Russian terrorists in Ukraine can do it. Fortunately, that medical team, they're alive, and today they have already returned to Ukraine, and their spirit is high now. They are having some rest and they're ready to continue working. The healthcare system continues operating and hospitals continue providing medical care for patients and everybody who needs it. There are several stages of evacuation in Ukraine to evacuate patients from the active combat area to some temporary triage hospitals, and then a decision is made where those people should be receiving medical care, be it in some safe place, either in some safe place in Ukraine, or if they agree that we transport them to countries of the European Union. And our ONCA patients, those children, have been sent to the United States of America and Canada. There is a clear mechanism established, also due to initiative by our First Lady, Elena Zelenska, who spoke with First Ladies of the EU countries, so they receive our children and their humanitarian convoys sent to EU countries. There have already been 6 convoys of that type, and more than 300 children have already been sent to receive treatment, oncological treatment outside Ukraine. Health facilities continue receiving funds under the medical guarantees, healthcare guarantees program. We have not stopped that program, we just changed it now. They are receiving 1/12 of what they planned, what they contracted, so every month they receive the respective part of their annual contract. We have also launched separate packages, and yesterday the government approved the package to maintain the human potential, the staff. Under that package, funds will be redirected to those hospitals which were lacking funds to pay patients, humanitarian organizations and businesses who have responded since the very first day of the war, and they have been helping hospitals and medics for them to be able to provide quality treatment, effective treatment. Also, we continue supplying cars for ambulances procured in a centralized way. More than 100 cars have already been provided to ambulance teams, and now we have been preparing 7 angiographic systems so that in those hospitals where there is no active combat action, this new technology will be used for diagnostics and treatment of strokes and heart breaks. Pharmacies, during the first days of war, our pharmacies stopped working. That was a problem. Now we have already renewed operation, restored operation of more than 10,000 pharmacies. By the end of the week, there will be more than 12,000 of those. And our pharmaceutical factories continue operating. Today, I personally visited one factory which temporarily suspended their operations because of the aggression, because of that shelling by invaders. Now they have renewed their operation, producing medicines, manufacturing medicines, and those are medicines which are needed in pharmacies. There are some problems with logistics because it's quite difficult logistically today to distribute those medicines because there are shelling events, there are military hostilities in our country, but we make every effort we can to have those medicines brought to pharmacies so that everybody who needs medical care would be able to receive it. A separate issue is that of humanitarian convoys across territories occupied by invaders. We maintain communications with the World Health Organization, Red Cross Society, and Red Cross Committee, and other organizations in the UN system for them to open permanent humanitarian corridors to be used to supply medicines to those territories. Most important medicines needed for people: insulin, thyroid, drugs, and other medicines needed. Because, you know, the invaders cannot, do not let our logistical support get through, so we cannot bring those medicines there. Thank you for attention. I'm ready to answer questions. There are several questions from our Ukrainian journalists. I will announce those. Now, first of all, we have a lot of internally displaced persons. What is the algorithm for them to receive medicines, to receive the medical care that they need? Well, first of all, as far as medicines are concerned, those people who relocated, who were forced to relocate, still can use, you know, in pharmacies, there is that program, affordable medicines. So if that person has a prescription, they can visit any pharmacy and receive those medicines for free, or if the price is above the limit established by the state, there will be a small copayment. For insulins, there is no copayment. All insulins are free of charge in all those pharmacies that participate in affordable medicines program. Medical care. If you're talking about urgent care, hospitalization in any hospital facility in Ukraine, again, medical care will be provided for free. About family doctors, we understand that those people who moved, who temporarily changed their location, they have their declarations with family doctors, general practitioners in those occupied territories. We issued an order today whereby we clearly approve that those family doctors in territories to which those people relocated can provide medical care to those people, can issue prescriptions and make routine prophylactic vaccination. So you are welcome to approach the primary care center or hospital center. You will receive medical care. Victor, we all understand that now the medical system has been really overloaded. Maybe there are some online services which would help Ukrainians get medical advice. To continue with the second question, those who needed long-term treatment, permanent treatment, first of all, those onco patients, when they move to a different place, the medicines will follow the patient. Now we redistribute the medicines to increase the numbers of the quantities of medicines to be sent to the western part of Ukraine, because there we have more Ukrainian people getting medical help. Medical consultancy, medical advice, 160-2019, you call it, and their doctors, you ask the operator, and their doctor there, you will be redirected to doctors, and depending on what sort of special advice you need, you will get that advice from a specialist. There are surgeons, psychologists, obstetrics specialists, gynecologists, and other specialists who provide advice approved by the Ministry of Health. So the phone number 1-800-60-2019. That's a free hotline. Thank you. Thank you. We have a question here.
Judah, I work for The Economist and the Financial Times. I've got 3 questions. you mentioned 10,000 pharmacies being opened in the country. Do you know how many pharmacies there are in Kiev and how many of them are open? And although you said you were resolving the problems of supply, for supermarkets there are no more lines, but in front of pharmacies there are still lines. Do you think that that's going to be resolved in the next few days? The second thing I wanted to ask you about was, do you have any numbers for dead and wounded who have been brought into to hospital today from the attack today in Retroville? Because apparently that's quite high, but I don't know, I'm asking you. And the third thing is, could you say something about the long-term damage to health in Ukraine? Because I imagine that actually a lot of damage will be done because people just can't go to hospital for regular treatment or can't see their doctor for regular treatment. So you're going to have a backlog of problems in the future. Thank you.
Дякую.
About the number of pharmacies open and working in any and every city or town or provincial center. On the website of the Ministry of Health, jointly with tabletki.ua website, or on tabletki.ua itself, you can see the map, which is updated every 3 hours, and it has the pharmacies open, the pharmacies working, and the availability of core medicines, in particular insulins, steroid drugs, bandage material. You can see all this information on that website. Again, it has been initiated by the Ministry jointly with businesses and volunteer organizations to show the whole map of the whole Ukraine, to understand where we have the pharmacies working, to avoid wasting time, so that you would not go to the pharmacy which may be closed. Now, about the lines and people waiting in lines. Unfortunately, we have war in Ukraine, war which has been happening because of full-fledged invasion of Russian Federation in Ukraine. Can everything work like it did in the peacetime? Unfortunately, no. There are a number of factors, both objective and subjective ones. We ask everybody to make a no-fly zone, to close the sky, and the Russian Federation should withdraw from the Ukrainian territory as established by all international documents, international treaties. And on your third question, whether it will affect the health of Ukrainians, yes, it will affect it, because 2 years before that we had that coronavirus epidemics. Now we have war. All these things restrict access to medical care, restrict access to screening programs. It does not allow us to identify at early stages those oncological diseases, to diagnose tuberculosis at an early stage. As a result, people will come for medical care when they already have clear symptoms, and it will be more difficult to treat those diseases at that stage. And in economic terms, it's also to treat oncological diseases at third or fourth stage, it takes much more money than at the first stage. These are just two examples, but there are many examples like that. So this is one of the components how that war indirectly affects the health of Ukrainians. Any more questions? No more questions. Thank you very much, dear Victor. Thank you, dear journalists. I'd like to remind you that we are working for you, and now we are developing our schedule for our next briefing. So monitor our announcements and join us, join our briefings. Thank you. I'd like to thank Skyloft Hotel, where we are located, and I'd like to thank our team working every day for you to get the latest news, up-to-date news. Thank you.